mom of two boys, but I have a 2.5-year-old son who is on the spectrum. I am part of TACA. I am a mentor. I am a mentee. I am in everything, just trying to learn and get as much as I can, like all of you here. So if any of you aren't familiar, TACA Hawaii is a local chapter of TACA of Curing Autism. We currently support over 800 families in Hawaii by providing support and education opportunities through meetings, coffee talks, presentations, mentors. If you have children on the spectrum, it is a huge resource and support center for you. So take advantage of it. We have to always do a disclaimer, so bear with me. Here's the legalese. Talk About Curing Autism provides general information regarding medical research, treatment, opportunities, therapies, and nutrition to the autism community. The information comes from a variety of sources and is not independently verified by TACA. Nothing presented in print or at meetings should be construed as medical or legal advice. Always consult your child's doctor regarding his or her individual needs. And finally, it is recommended that you do not share confidential information about your child. All right. We're done. I'm now going to introduce our partners in putting this presentation together tonight, and that is the Hawaii Autism Foundation. So please say hello to Tracy, our Executive Director.
Hi, good evening. My name is Tracy Janowitz, and I am the Executive Director of the Hawaii Autism Foundation. Thank you for coming tonight. I know it's Saturday night. We appreciate it. And I'm just going to be up here for just a short minute just to tell you, remind you that we are here as a co-sponsor, and to remind you that our mission is to educate and help families in Hawaii find and fund treatments for autism spectrum disorders and to develop resources. We ensure our children have the tools and support and transitional support that they need to reach their full potential and thrive as adults. And so what we do basically is we help to fund programs statewide. And one of the things that we did do was help to start our sister organization, which is TACA. So again, we just wanted to thank you for coming out tonight. I also, just a real short minute, another program that we've started is our Caring for the Caregiver program. We have if you haven't heard of it, it's working with youth to teach them to swim, and parents who want to start an active, healthy lifestyle. We have a session that will be starting on November 22nd. If you're interested in learning more about that program, it is starting up, like I said, November 22nd. Catch me at the end of this. I see a couple of familiar faces whose children have gone through the program, and I'm happy about that. But if you want more about the program, catch me after, and I can get you in touch with that program that, again, is starting on November 22nd. Thanks, Chrissy. Thank you, Tracy. And we have some brochures about who we are.
So this evening is going to go over to introduce all of our doctors, and then we're going to have two short presentations. One about this wonderful center that we are going to learn and have access to, the MOA Center, and then Dr. Taketa-Wong is also going to do a presentation on evidence-based medical treatment. And then we're going to open it up for question and answers. We're hoping that we're going to have a lot of time. So if you have questions, hold on to them. We're going to get to them, and we're going to pick their brains clean. So if you could all please say a warm welcome to our first is Dr. Green. He's sitting in the middle. All the way from Oregon, Dr. Green comes with years and years, over 14 years of experience. He's helped treat and evaluate over 2,500 children on the spectrum. So he is a wealth of knowledge and resources. He holds clinics here in Oregon, also in Portland, and mentors doctors literally in countries all over the world. So you have an expert. Take advantage of him while he's here. The next doctor we're going to introduce is Dr. Taketa-Wong. She is one of our own, right down the street. We keep her here all the time. Dr. Taketa-Wong is a naturopathic physician and licensed acupuncturist specializing in autism, ADHD, and other pediatric neurodevelopmental disorders. She's completed training with the Autism Research Institute and the Medical Academy of Pediatric Special Needs. She knows her stuff. She also is a great resource on caring for siblings of those who have special needs. That's also volunteers with a support group and also has a sibling herself with special needs. So she's just a great resource for the whole family. And we have Dr. Apal Ludlam, also Dr. Noe, who is graciously handed me this. Thank you. Need some last minute changes. She's a board certified pediatric physician, a fellow of the American Academy of Pediatrics, an assistant clinical professor at the University of MOA, John A. Burns School of Medicine. Dr. Apal is a MOA school valedictorian and graduated from the University of California at Berkeley with honors. She received her medical education from the University of Hawaii School of Medicine and did her pediatric internship and residency at the University of Mexico and was chief pediatric resident at Kapiolani Medical Center. She also did fellowships in community pediatrics and medical education and has a master's and PhD in clinical research. She is a fellow of the American Academy of Pediatrics and a member of 3 AAP sections, adolescent health, developmental and behavior pediatrics, and integrative medicine, and is also a member of the Hawaii AAP. Dr. Apal has over 25 years of private and public pediatric service. She practices holistic pediatrics and the CAM department at the University of Hawaii School of Medicine, the University of Integrative Medicine Practice Group. Dr. Noe has attended at least 2 MAPS continuing education conferences and is a MAPS fellow candidate and is currently specializing in her holistic pediatric practice in autism, ADHD, and pediatric special needs. So, please give her a warm welcome. So we're growing, and this is really exciting because we need, the more doctors we have, the more resources we get for our kiddos. So I'm going to ask Dr. Noe to come up and introduce the MOA Center and to talk a little bit about what her program and what MOA can do for our kids.
Thanks, Christy. I started walking toward this podium maybe about 5 years ago when the moms of the children with autism or on the spectrum came to us at the medical school department of complementary alternative medicine and asked us to help out. So our chairman, Roseanne Harrigan, my mentor, sent 2 of us to a DAN conference, and I was blown away. But I couldn't quite figure out, what I could do to offer besides just plain old bread and butter pediatrics, which is what I've been doing for 25 years. And then about a year ago, an email invitation came to go to a lecture with Dr. Signal. And that was the beginning of just all kinds of doors opening for me. I sat there and listened to this brilliant person talk about things that were totally not covered in medical school, like a biome. What is a biome? What are these, things in our guts? What is this mind-brain connection? And methylation and sulfa problems and mitochondrial illnesses and energy medicine, and it was a total eye-opener. I have people in my own family who have ADHD and are on the spectrum. And for many years I've looked at these people and thought, oh my gosh, why are they doing this? What is this? And it was actually Dr. Rossignol and going to his MAPS conferences that snapped it all into perspective. I've been going to American Academy of Pediatrics conferences for over 25 years, and they're fabulous. I join every year, I pay my huge dues, and I'm proud to be a pediatrician with, all the other pediatricians. But boy, when I got to the MAPS conference this past March, it was actually the best medical conference I've ever been to. It was cutting edge medicine. It was the kind of medicine I think we're all going to be seeing in practice in maybe about 20 to 25 years. It's stuff like, why do you take probiotics? What are prebiotics? Do you need to take enzymes? What is this gluten-free, casein-free diet thing? And why do I need to do that or try to do that? So I've gone to 2 conferences now, and I have just been a sponge. I've also had the chance to sit with Dr. Green and learn from his vast experience, I mean years of just brilliance. And Dr. Taketa-Wong and I have sat, and I've been to her office, and I have to say that I'm actually breathing for the first time in 2 weeks, because she offered to make me a tincture yesterday. So she shows up at the office here with this little thing that you put 40 drops into some water. And I thought, yeah. So I put the 40 drops in the water, drank it, and it was like, wow, I can actually, for 2 weeks now, I've been on the conventional medicine stuff, taking steroids, breathing steroids, pumping, doing the bronchodilator stuff, watching my GERD, and boy, if anybody's having any trouble breathing, you need to make an appointment to go see Catherine. So I'm hoping that she's the first naturopath to join our Department of CAM. I've been pressuring her and talking about how neat it would be to have a naturopath, in the department. And so we shall see what happens with that. I've had the privilege of working here at MOA, Mochiko Okada Association, and Norman Oshiro is in the back. Yeah, please. I'd like to introduce Norman, and he can talk to you a little bit about the Mochiko Okada Association. We are a little subset of this wellness center, our integrative medicine part, and MOA is amazing. They're not only among the nicest people I've ever met, but the most artistic. And as a painter, I love that. So all these flower arrangements and, just the whole feeling here, the peace and the wellness, that's all part of this MOA organization. And Norman is their CEO. I'm going to turn some of my time over so that Norman can tell you a little bit about MOA and why we're here as part of it. And we're supportive of them, and they support us and let us practice in this beautiful place. So let me introduce Norman Oshiro, CEO of the Wellness Center. And here's Norman.
Hi, good evening, and welcome to our Wellness Center. MOA stands for Mokichi Okada Association. He's a Renaissance man from Japan, and we are, first of all, his vision was to create this new civilization. This is a world in which safety and longevity of human life is ensured. So when we say safety, we're talking about no sickness, no poverty, no conflicts in the world. And longevity, and we all know, the way the human body is made, we should be living 120 years or more without being ill, without any kind of degenerative diseases. So we have a choice in that. And so this is what our wellness center is about, and we're partnering with UH Integrative Medicine to bring you complementary alternative medicine. Our program is the Okada Health and Wellness Program. It's a mind, body, spirit program consisting of this energy healing called Okada Purifying Therapy. So we've been having really excellent results. From 2006 to 2007 in the Democratic Republic of Congo, Dr. Mikobi there did a study on 20, the control group had 20 people that was diagnosed with sickle cell anemia. I don't know if you know about sickle cell anemia, it's incurable. It happens to people of color. And so 20 did Western medicine, and then there's another 20 who did the purifying therapy. They did it 5 days a week, twice a day for 45 minutes for a year. So after a year, the results were on the Western medicine side, 19 of the 20 were hospitalized. And in fact, I think all 20 had episodes of going to the hospital. Whereas on the MOA side, 3 people. And then they did all the blood tests and all of that, and then, the hemoglobin counts and the bilirubin and creatinine and everything. The MOA side was way better. And they did a 4-year follow-up study, and what they found was only 13 of the 20 on the Western medicine is still alive after 4 years. Whereas on the MOA side, 17 of the 20 is still alive. In fact, I met one gentleman from there, and he said he was completely cured of sickle cell anemia. So we also have good results with stomach cancer, breast cancer, lupus, people recovering from strokes. And these are people who come here and volunteer. So our therapists are volunteers because they got good results, so they come and give back. So again, that's our purifying therapy. We also believe in the nutrition as well. So we do a nature farming, which is pure organic farming, and also nutritional counseling. And the third part is arts and culture, or the beauty aspect. So we believe that, by enjoying beauty, you make your life more enjoyable, that you're able to enhance your natural healing ability. So that's our wellness program, the 3 major programs combined. So if any of you would like to try our program, there's no charge for the first time. Please come and experience that. So any you friends, family, anybody, we're open at no cost. Just please come and try it and see how you like it. Thank you.
Okay, I'm going to share this podium with one more person who's probably the most famous doctor I know personally, and that's Dr. Terry Shintani. Dr. Shintani is amazing. He's a physician, an attorney. He trained at Harvard in nutrition after he finished medical school and realized, unlike the rest of it, he's just brilliant. And he thought, I got something like, I don't know, a tiny little morsel of nutrition, but nutrition is so important. So along the way, he's actually written like 9, 10, 11? 14 books. He's been on national TV, like Good Morning America, and he's in the Encyclopedia Britannica. So he's just incredible. We had the privilege of helping a little girl with autism who had horrible seizures. She was only 3 years old. And one night, Terry and I will tell you what we did to help her seizures get better. But Dr. Shintani is an expert in nutrition and also energy medicine. And energy medicine is something we don't talk a lot about energy in traditional medicine. We talk about, the heart has charges and we're great with biochemical things. We're great with chemicals, with antibiotics. We're great with surgery. We know how to cut things out. But we're not as great with energy healing. And that's where Dr. Shintani comes in. And he's done some things that I'm amazed at. So let me introduce you to Dr. Terry Shintani, and then we'll take a little break from me.
I'm just going to keep this short. If you want to know about our department, we're one of the few medical schools that has a department of complementary and alternative medicine. Most of the medical schools have programs, but we're actually a complete department. I and Dr. Roseanne Harrigan, who does energy medicine as well, who is the chair of the department. I'm the associate chair in charge of clinical practice, but we published a study showing that there are more visits to complementary and alternative practitioners in Hawaii per capita than anywhere else in the country. And so it's very appropriate for us to have a department here. The department, we moved the department here because we like working with, quote, alternative practitioners. To me, one of the most ironic things is the kind of nutrition medicine I practice is called alternative healing. How many of you think that's ridiculous? That nutrition is alternative. That should be the center of treatment. How many of you think our medical system is broken? You see, I mean, it's virtually 100%. So that's why it's important for us to have a department as part of the medical school so we can gradually fold that into what's considered, well, we like to look at it as whole person approach, spiritual, mental, emotional, physical, including energy medicine, including, well, everything that we can, which is why we embrace practitioners that may currently be called alternative, but we think that's the future of medicine. The work that as many of you know, I worked many years in Waiana as a family practitioner, but I'm board certified in preventive medicine, and I do most of my work with adult medicine, getting them off the medication. But when I looked at the technology that I'll just mention briefly, we have a scalar energy chamber here, and that's what Dr. Powell and I published a paper about, because we were able to slow down seizures in an autistic kid really dramatically. We've had results of, I've had a couple of autistic kids, their function is better. One of them was incontinent. 10-year-old was incontinent because he would be so zoned out that he couldn't tell when he had to go. And the incontinence disappeared after sitting in the energy chamber. So we're starting to look at these kinds of approaches. If you want to know more about it, I actually do a free seminar where you can actually sit in the chamber, so you can sign up if you want to know more about it. We'll talk a little bit more about that. I also have handouts on nutrition and autism for you to have as well. So I don't want to say any more. Oh, I just want to also say that in the handouts you can find out about our department. Everyone in our department is either double and triple trained or quadruple trained. We have one MD who's a licensed acupuncturist, who's a certified heart therapist, who's also board certified in pathology. We have an internist who's certified in Ayurvedic medicine, and so forth. So everyone from our department who practices here is at least double trained in one conventional and at least one unconventional approach. So we always say, if you really want to get the best in holistic care, we're here for you. All right?
Thank you.
This handout is just some evidence-based studies on nutrients in autism.
I can speak for all of us. I've never had so much medical brain power. At our fingertips dedicated to our kids. So now I think we get to the really exciting part, which is the questions and the answers. So this is really an opportunity for all of us as parents and caregivers and family members. Oh gosh, the presentation, holy Moses. That's why you need a community, right? So we're first having a presentation, and then we'll get to the doctor. So Dr. Taketa-Wong is going to take us through right now evidence-based medical treatment for autism and ADHD. So hopefully if any of you here are new to evidence-based practices, Dr. Taketa-Wong is going to simplify it for all of us so we can all get on the same page.
Okay. Well, I'm very, very happy, very honored to be here. I'm really also excited to meet Dr. Shintani in person. I actually read your Eat More, Way Less diet book many years ago, and I got so excited about it, you know. And so, I mean, it's one of the things on my journey that led me to become an naturopathic physician. So, yeah, so it's very exciting to meet you, and I'm sure there are probably a lot of you who want to eat more, way less. So. So anyway, for a lot of you, this presentation is going over some of the basics of biomedical treatment. So for a lot of you, you probably know a lot of these things, but there are probably still details. And I'm going to go through things pretty quickly. This is supposed to be a 20-minute presentation, so I will just try to go through things kind of quickly. It's just an overview, and I'm just going to be touching on some things. And then there's more details in the handouts when you have the slides in front of you. And then if you can just save questions for afterwards, because the rest of it is going to be a question and answer session. So, again, disclaimer. You can read that in your handout, but it shouldn't be construed as medical advice. Et cetera, et cetera. My background: this is my younger brother, Michael. He's the reason that I'm here, that I'm doing what I'm doing. He is an adult on the spectrum. So it's been a long journey for him. He didn't start dabbling until he was 3. And he's working as a dishwasher at Big City Diner now for the last 9 years, and he's doing pretty well. So we're keeping on going and trying to still work with him. So so there was the introduction that kind of gave my background. So we know that the rates of autism are increasing. This is a graph, a study that was done in California comparing the rates of autism with mental retardation, epilepsy, and cerebral palsy. So you can really see that the rates of autism are skyrocketing, even when they take into statistical analysis of increased incidence with increased awareness and diagnosis, it's still increasing. So there have been a lot of new research studies that have come out that are talking about evidence-based medical treatments. And so Dr. Shintani gave a good reference of certain vitamins, but there are many, many other research studies, not only on nutrition, but on medical conditions that are associated with autism. And so the idea that there are medical conditions that are underlying the symptoms of autism and ADHD. And so, when you have the idea of an iceberg, so what we see are the symptoms on the top. That's only what's peeking above the water. But underneath, there's a whole huge iceberg underneath that we can't even see. And that's what we're trying to uncover when we're doing specialized medical testing and all these other things. So just treating the symptoms, you know, which is kill them with spray or swat them, but if the reason that the flies are there is because there's a bunch of garbage in the room, you can keep killing the flies until you get rid of the garbage, until you take it out, the flies are going to keep coming. And so what we really want to try to do is treat the underlying causes, take out the garbage, and then if you take out the garbage, the flies will go with it. Right? So, and you know, there's a lot of talk about genetic conditions associated with autism, which are important, but there are a lot of genetic conditions that, so when we're looking at some pretty common ones, cytogenic abnormalities, Rett syndrome, Fragile X chromosome, and microarray, the total of that only accounts for 21%. And so what about the other 79% of our kids that have a diagnosis but don't have some kind of association with a known genetic disorder? And so that's where we're looking at all these other types of conditions. And most important, things that are treatable, because a lot of genetic conditions, you might get a diagnosis, but you might not necessarily get, okay, what can we do to treat it? What can we do to help it? So most of you are familiar with the classic definition of autism. So impairments in the 3 spheres: communication, socialization, and behaviors. But what we're looking at is a paradigm shift of looking at autism and ADHD as biological disorders. And a lot of these things we also see with other types of special needs, so Down syndrome and some other things. And so the neurological system, I'm going to talk about each of these 4 systems, and I'm going to go pretty quickly through them, but I'm going to, again, this is like an overview and kind of, you know, hitting some of the highlights. So the neurological system, the brain, right? We know that's involved. The digestive system, the immune system, and then the metabolic system. So. And you know, that being said, we definitely recognize that all the other therapies, behavioral therapy, speech therapy, occupational therapy, all of these therapies are really important. But then the medical piece is one more piece of that. And oftentimes what we see is that when you treat the medical piece and your child is getting better, then a lot of times the other therapies will be more effective because your child is healthy enough to be able to get the input and receive the important information that they need from all those other therapies. So metabolic system. So metabolic includes a lot of things. Thyroid, liver is another one. You can think of the liver as our filter. So it's basically filtering out all of the junk that we get exposed to in the world. And with a lot of our kids, we find issues with the liver being able to break down and get rid of the junk. So some of those liver detox pathways, specifically methylation and sulfation, are really common ones where we see problems. And then I'll talk about some of these other conditions. So cerebral folate deficiency. So, you know, how many of you moms are told you need to take folic acid when you're pregnant, right? And why is that? It's because folic acid is really important for brain development. So one condition that we see that's common in autism, one of the studies found 75% of children on the spectrum that it's an autoimmune condition. So you can see these yellow things over here, and these are antibodies. So it's antibodies that their brain is making against their body's own cells. This over here, the square is, this is a neuron or brain cell. And folic acid needs to get into the cell in order for it to do what it needs to do. But when you have these antibodies, what they're doing is they're blocking the gate over here for folic acid to get in. And so even if you give folic acid, in these kids it can't get in because you've got these antibodies that are blocking the gate. And what you can do is you can basically give the active form of folic acid, which is folinic acid or leucovorin, or L-methylfolate, which is also called Deplin, as one pharmaceutical version of it. And those are active forms that basically can bypass that gate and be able to get into the brain cell to do its work. So this is something pretty recent, discovered in 2005. And another reason, I mean, there are a lot of things talking about milk in our kids' diets, but what we find is that cow's milk and goat's milk and camel milk as well basically contains a protein in it, antigen, folate receptor antigen, that increases the production of folate receptor antibodies, so those yellow antibodies that are blocking the gate. So you can see over here, I don't know if you can see it that well on the screen. I don't think it shows it very well with the laser pointer, but the initial sample over here of levels of folate receptor antibody, this is 6 months on a milk-free diet. So you can see that the levels really went down. And then when they re-exposed with milk, then the levels went back up again. So that's one reason to have our kids on a casein, which casein is the dairy protein, on a casein-free diet. So you can read through some of these slides, but something that's really exciting is what they found, some of the younger patients, ages 2 and 4, when they found these antibodies and treated with folinic acid, they actually had full recovery from autism. And children that were treated older still saw an improvement in those neurological symptoms. So that's something that's really exciting. This scary diagram, for those of you who are not biochemists, is basically methylation. So this is a liver detox pathway that has to go on in order for our liver cells to be able to break down toxins and get it out of our body. And what we see is we see problems in this pathway. Certain places in this pathway are being blocked, and so basically making this thing called glutathione. Glutathione is a really important antioxidant, and it helps us to get rid of toxins. And so when you have blockages in this pathway, you're not able to make enough glutathione to help get rid of the toxins in your body. Mitochondrial disorders. This lovely little purple thing here is a mitochondria. It's inside of each one of our cells, and it's the thing that makes energy in our cells. And so what we see are problems with the mitochondria in a lot of our kids, and there are nutrients we can give to help with these things. But things when you see low muscle tone, developmental regression, easy fatigue, poor physical endurance, seizures, digestive problems, growth delays, those are all hallmarks of mitochondrial problems. Propionic acid. So propionic acid is a food preservative. And what we see is, it's also caused by overgrowth of a certain kind of bacteria called Clostridia in the gut. And so propionic acid, what they did in one study, they injected rats with propionic acid, and they found that those rats displayed autistic-like behavior. They didn't have the normal social behavior where rats interact and play with each other and greet each other. They were really aloof. They spent time alone. And then when they looked at their brains, they found that those injected rats showed inflammation in the brain. So some of these metabolic diseases are treatable, and we won't go into the details, but basically that's the good news, is that they're treatable. Our brain. So we see a lot of problems with the brain, so brain inflammation, imbalances of neurotransmitters or brain chemicals, and then also with the what we call the fight and flight system is supposed to be balanced with the rest and digest system. And we see imbalances in those systems. And then seizures, too. A lot of our kids have seizures. So inflammation, this is one study, and this is basically looking at brain tissue in children with autism. And so all the blue things over here, and you can see over here all the purple things, these are all cells that are characteristic of inflammation. And so you can see that there's a lot of it in the brain tissue. And then also antibodies. So we find a lot of these kids making antibodies, their body is making antibodies that attack the brain. And that's one thing that causes the developmental delay, delayed language, all of these types of things. And even in ADHD, then you can have difficulty with focus, with attention, with some of these things. So digestive system, a lot of our kids have problems with digestion. So food allergies, they're not absorbing their food, what we call dysbiosis, where you have bacterial infections, yeast infections, viral infections, parasites, gut inflammation. And so when we look at these things, what often we'll see constipation, diarrhea, abdominal pain, food allergies, flatulence, bloating, acid reflux, and then your child might not have all of these things, but a lot of these are really common. So a lovely picture of diarrhea and fecal smearing, which some of you I'm sure have experienced. Sorry if you have a weak stomach. This is a parasite, and then this is basically, this picture over here is a picture of an esophagus, and all the yellow stuff that you see over here, that's all candida, it's a yeast. So normally the esophagus should be nice and pink and shouldn't have all that yellow stuff on it. So this is a quote from Tim Bowie, who is a Harvard gastroenterologist, and he basically, there's a paper that he published in the journal Pediatrics where he talked about behaviors in autism that can manifest as a result of gastrointestinal or digestive problems. So, self-injury, aggression, he said maybe a hallmark of gastrointestinal pain. And so he was saying that expert clinicians have observed that aggressive and self-injurious behavior may be the primary clinical manifestations of GERD or acid reflux in individuals, but often those symptoms are associated with, they say, oh, it's a behavioral issue. We need to untrain this behavior. But a lot of these kids actually have underlying digestive problems. This is one example. So this is a girl that has self-injurious behavior, biting, scratching herself. And so that what they found was esophagitis or inflammation of the esophagus. She had really severe inflammation of her esophagus. And so you can see over here, it's lumpy. So, and it's really inflamed. There's areas of red over here, and it shouldn't be inflamed. It should be nice and smooth and pink. So, and so basically her self-injurious behavior resolved with treatment. And so also pressure-seeking behavior, when we see some of our kids like to lean on chairs or tables or the sofa, when they're always pressing on their tummy. If you think about when we have diarrhea or, our stomach hurts, what do? We do this, and we're leaning over and holding our stomach, putting pressure on our stomach, because it often will make it feel better. And so a lot of our kids, especially if they're nonverbal or they can't very well express what's going on, then that might be a sign of digestive pain. Diets. So in the digestive system, we talk a lot about diets. I'm not going to go into these in detail, but a lot of you are familiar with gluten-free, casein-free. So the basic idea being that over here, gluten and casein, I'm going to go to the next slide. Basically, gluten and casein, these over here are the molecules. So you can see the amino acid sequence over here. And they're quite similar. So this is one part of gluten, this is one part of casein. And they're both broken down by an enzyme called DPP4. And I'm going back to the previous slide. So what happens is if that you don't have the enzyme to break it down, these molecules stay intact. They can cross the blood-brain barrier, basically get into the brain, and they can bind to receptors in the brain over here that cause opiate-like effects because their structure is similar to opiates. And so that's another thing, another reason. So these are just some studies on the diet. So that is one diet, and then that's usually the one that we kind of start off with. These are some parents' observations from the effects of going off of gluten and casein. Now he has regular daily stools, they're no longer foul-smelling, doesn't struggle to pass stool. He's much more calm and mellow. He used to get violent and scream, but now he cries. He used to have tantrums every day. Now it occurs maybe once a week. He has more eye contact, producing words, better attention, focus at school, and less hyperactive. So, and then this one was with a child with ADHD, this last one. Other types of diets. Soy can also be a common sensitivity in a lot of our kids. Eliminating allergies, so testing for allergies that your child might have, eliminating those. Feingold is basically a low phenol, low salicylate, and some other things. Again, this is just like an overview, so you can talk to your taco mentor, talk to other people here to get more details, about the diet, or during the question and answer session. The specific carbohydrate diet, or SCD, gut and psychology syndrome, or GAPS diet, low oxalate, and candida and body ecology diet. So these are some other diets that can be helpful. Immune system problems, chronic infections, yeast, fungal, bacterial infections, something associated with what we call PANDAS, or it's basically where we see a lot of OCD associated with these types of infections. Allergies, eczema, autoimmune conditions. So these are just some pictures, where you see over here, you see eczema, allergies, so dark circles under the eyes can be a sign of allergies. Can also be, of course, a sign of sleep problems. And then impaired immune system, so toenail fungus, yeast issues are really common. These are just some research studies. And so basically the medical approach to treating, autism spectrum disorders and ADHD is when you come in, we do medical history, take a physical exam, do lab testing to try to identify what are the underlying conditions that your child has, and then identifying and minimizing exposure to toxins in the environment. So trying to eat more organic, whole foods, not a lot of foods with preservatives and additives, and just trying to minimize exposure to heavy metals, other toxins. And getting a nutritious diet. So even if you get gluten and casein on the diet, doesn't always mean that the diet is really nutritious. So trying to get, and sometimes it can be really hard because some more kids are super picky eaters. I have one kid that the only thing he would eat was those fried pork rinds, the chicharrones. That was the only thing he would eat, and his cholesterol was sky high. So we were able to eventually get him off and expand his diet, but some of our kids are really picky eaters, so it's a challenge. So trying to get nutritious foods into them. And then, vitamins and minerals, sometimes they need a lot higher doses of certain vitamins or minerals that, you can't, it would be hard to get that much of a food in. And then treating medical problems. So with all of those systems, the neurological, digestive, immune, metabolic, and a lot of them really overlap. So, when I was showing those 4 circles, a lot of them are overlapping. If your immune system isn't functioning well, then you're going to be tending to get infections. If you can't detoxify well, then that's going to lead to an accumulation of toxins in your system, and then you can get inflammation in your brain, which can then lead to inflammation in your gut, or vice versa. So a lot of these are really interconnected. So when we treat one system, then oftentimes we're treating other systems as well. And so these are just some resources, Talk About Curing Autism, and just the general takanow.org site is a huge wealth of information on all of the diets, any of these things that you want to look up. There's webinars from physicians and from other parents, and so much information there. Hawaii Autism Foundation have their website, the Medical Academy of Pediatric Special Needs, Autism Research Institute, Easter Seals. This Pinterest site has some really good gluten-free, casein-free recipes with photos. I'm a really visual person, so I like that. And then Crystal Basola is a great nutritionist that she has a lot of experience with gluten-free, casein-free, and a lot of times, especially if you are new to this and feel like you need some hand-holding, she can be a really great resource. So that's it. And we'll go to our question and answer session.
Thank you. I hope I'm not the only parent in the room, but every time I see presentations like this, I just get happy. Like I get re-energized. I'm ready to go home and start anew and bake something new and fun or whatever, right? Raise a supplement. Anyway, thank you, because I really, these Saturday nights they work for me. So I was really excited to get to the question and answer period, clearly, and now we finally reached it. So I have one opener question to start, and then I hope all of you will follow suit with all of your questions. But the first question I have was for Dr. Noe. I'm really excited. I'm sure a lot of parents are having to have a pediatrician on board who's familiar with some of these biomedical treatments that we're doing. So I'm just wondering if you could share with us what your practice might look like. Are you accepting new patients? Do you accept health insurance? Do we just call you? How does this work for us parents here on the
Okay. Definitely, the practice is open to new patients. I'm working on accepting insurances to help with that cost. I know things can get pretty pricey. I myself just paid a huge straw bill. So I'm finding that putting this practice together has a lot more moving parts than I anticipated. When I first thought about doing this, adding this to, teaching part-time at the medical school. So I'm still working with the insurance companies, and that part isn't in place yet. But the practice is absolutely open by appointment. I'll be seeing patients on Monday afternoons, Thursday afternoons, and hopefully Saturday mornings. shout out and a thank you to a very, very special, wise, generous heart. That's Julianne King from the Hawaii Autism Foundation and Tracy Janowitz. I wouldn't be sitting here at all if it weren't for the two of them and their vision and their hard work and enthusiasm and the support. So this is just kudos to an incredible organization with much vision. The other thing is, I see myself practicing as a team with Dr. Green and Dr. Taketa-Wong. There are things that I don't feel comfortable doing yet, like chelation. So anybody needing chelation will be going to Catherine until I get up to speed on that part of it. And I wanted to emphasize also that my huge respect for Dr. Green. Watching him, sitting and watching him with these really complicated, devastated patients that were sitting there looking, in vibrant health and happy and completely not like what they looked like when he first started working with them over the years. I'm also hoping that Dr. Green joins our department. Dr. Shintani, Dr. Harrigan. And I've learned so much from the two of them just in the past year.
Something to talk about. It's really my dream coming true to be sitting here, the four of us, from different angles, approaching this problem. When we say it takes a village, it takes a city of every skill that we have, every different perspective to bring help to the children and to the families. So I always encourage people that I mentor, that I work with, to bring their tools and their skills. And you see what incredible tools Catherine has to assemble this very complex illness. And it's a very up-to-date presentation she just made that covers an awful lot of the bases of things that we really want to think about. And then our task, as we begin to think about all these aspects of the problem this child may be having, is deciding what many interventions we can bring to bear on that set of problems. Just to pick out one, for example, the folate receptor issue. When it was free to do that testing, we did a lot of antibody testing, and found about 50% of the kids have folate receptor antibodies. A lot of the children. It's one of the highest percentage findings. So pushing glucagon and Deplin and folinic acid, really high levels, 1 to 2 milligrams per kilo, or 25 to 50 milligrams a day of these vitamins. Some of the kids just absolutely don't respond. They respond negatively. So we've had the capacity to test folate metabolites in the blood and the whole folate metabolism pathway, and found that some of the kids, even on really high doses, are low. So this brings up one of the basic points that we have. You can put it in the mouth, but it doesn't mean it's going to get to the brain or even to the blood. And for some of these kids, it's been really helpful to add, to inject folinic acid. And I've come to think of it in much the same way as I think of B12. It's a big molecule. Putting it in the mouth doesn't guarantee anything that's in the beginning where you're trying to get it, particularly into the nervous system. So that general concept applies to lots of the things that we do, that you put in their mouth, and even if they swallow it, which is a big accomplishment, doesn't mean it's getting to where you want it. So we still have to look functionally at output, the child's output, and lab output, and the findings that show that we're getting something. We're functionally accomplishing what we're trying to accomplish with a specific nutrient. So anyway, it's wonderful to hear about the work with energetic medicine. I actually started in holistic medicine in 1978, and to me, the most important healing force is love. And it's what brings me to these meetings is I feel so much love in the room and so much love for kids, from parents and aunties and grandparents and therapists. And that's really the highest energy that we have to offer. And it includes our intention. Funny story about one of the kids, one of the worst eaters that I'd seen. She ate 4 foods for 3 years. And they were weird. Asparagus was one of them, and green beans, and no meat. And 2 other, I can't remember what they were. Michelle was her name. And folks taught her to take vitamins with a syringe. And she's really good about taking her vitamins. They would put the vitamins in the syringe and hand it to Michelle. Here, Michelle, take your vitamins. She just put it and push it around. So they had the idea to make soup, put it in the syringe, and hand it to Michelle and say, here, Michelle, take your vitamins. And she'll take soup out of the syringe. And it's intention, it's connecting with our intention. And it's a very, very powerful force, and it's something that we don't always realize that we may convey a different intention than what we more deeply mean. For one thing, the misperception, misrecognition of children's abilities, and almost always underestimation of what's possible for them, sets up a kind of set of negative intentions in the classroom, in therapy, even in the parents. On the one hand, you don't want to set over high expectations for your child, but demands, and offering all the possibilities and keeping your mind open, because I promise you there's always more going on inside than you think, and it's most of it. So anyway, questions?
And I'll ask on that one.
Dr. Taketa-Wong, you gave a lot of slides based in a great deal of medical research over the years. But you are now practitioners talking about treating real people in clinical situations. But could I draw your attention to the research which is going on worldwide, and apparently going much faster, into transcranial magnetic stimulation. I think that is the term.
Yeah.
It is where magnetic stimulation is applied directly to the brain in a clinical situation, and is being specifically directed at autism. And the leader in research is in Deakin University in Melbourne, Australia, but it is now being coordinated worldwide. Now, this is a technique which I understand has been used for about 20 years to treat depression. So I'm just wondering if you are aware of this research and where it's going. It doesn't look as if it's going to have immediate results, but it looks like it could be important.
Yeah, I mean, I am, and I know that Dr. Green is, aware of TMS too.
Could you take it for the rest of us who maybe don't know, could you do a quick snippet on what it is and then your thoughts on it?
Well, I mean, it's basically what he was saying was basically it's stimulation with magnetic forces to different parts of the brain. And as I understand it, that there's different types of settings. Some can be more of an excitatory setting, and some can be more of a, I guess for lack of a better word, maybe calming types of settings. And so then you have to really look at what your child is dealing with. I know that we have one family here that's had really good experience with transcranial magnetic stimulation. So I know that they had to go to the mainland for that. And I don't know if they want to talk about their experience with that. I know that Dr. Green, has a lot of knowledge about that too.
Yeah, I have two patients who have gone to New York to do that quite a while ago, 8 or 9 years ago. Michelle was one of them. And my attention was the other one. who, a Missouri patient who behaviorally was non-autistic, but had just a few words. Mom got in touch with Norm Sheely, who's the neurosurgeon who developed the TENS. And he gave her a TENS unit to apply on 6 different acupuncture points, some of the head and some of the joints in the ankle and so on. And in 4 or 5 weeks of applying this, her boy began talking and became fluent in about 3 months. She had been set up to do transcranial magnetic stimulation. She went and had the studies done. He looked like a good candidate, but he was thriving with just the TENS unit. I bought 2 of them and gave them out to people to try it. Nobody else has had that response, but very, very provocative and fascinating how electrical stimulation, a variety of sorts, can be involved in. I think it's worth mentioning also that the EMF concerns that are becoming much more better recognized. Lots and lots of research showing electromagnetic pollution, dirty electricity and microwaves have produced some of the same biochemistry that we see in the kids, the disruption in oxidative stress problems, the inhibition of melatonin, inflammatory activation. And the first thing for all of us to do, me, everybody, is to take these things away from our heads and these cell phone things and away from kids' heads especially, and begin to be more aware about microwaves and Wi-Fi and modems and so on. And look, some of the kids are symptomatically responsive to those changes. You can be rewarded quickly by making changes, and others it's not. There's a soup we're in, and it's hard to tell. You're still in the soup. You just went out to the edge. But it's very provocative. My dear friend Martha Herbert has written a really thorough review article, 2-part review article on this, and the plausibility of EMF as the cause of the autism epidemic. She's willing to say the plausibility, and she's not overboard about that, but it's certainly, there's a lot of biochemical disruption that can be attributed to that. Some of the mystery where we're chasing molecules and we're chasing toxins, we're chasing vaccines and antibiotics and C-section, which are all pieces of it. EMF is a constant in the life of our kids, and increasing exposure to constant.
Yeah. Our experience, Noe and I published a paper on that girl who had autism, we stopped her seizures. She was having 6 to 10 grand mal seizures every day, and we dropped it down to 4 to 5 1-second twitches. And it happened pretty quickly. It was about maybe 2 or 3 weeks of treatment. She got better as time went. She actually came to our scalar chamber for a while. But how many of you have heard of a fellow named Dr. Jerry Tennant? Some of you?
I have.
Yeah, you have a biomodulator. See, a biomodulator is similar to that TENS unit that you were talking about. And I actually flew to Texas to learn about his system because it's very interesting. He uses a pulsed electromagnetic device that pulses electrical energy into specific low energy points, including acupuncture points. And he's gotten some really surprising results. I mean, there's one woman there who had 2 autistic kids, and she says they're no longer distinguishable from the general population using this device. But Dr. Tennant basically says that healing, he wrote a book called Healing is Voltage, and he thinks one of the problems is in autistic kids is their voltage has dropped for some reason. That's why the mitochondria is important. That's why nutrition is important. And he uses the biomodulator to add energy to points that may be blocked for some reason or another. So that's one approach. The other approach that we have our scalar chamber. And if you want to know more about it, like I said, if you give us your email address, I'll set up a full lecture on that for you, and you can try it out. But what I think is happening in the scalar energy chamber, we actually have a chamber here. If we have time, you can see it. There's no EMF in there. I have a Gauss meter. I'll show you. Electromagnetic frequency is canceled out. That's why they call it scalar energy. Electromagnetic is vector energy, it points somewhere. And the problem with vector energy, electromagnetic EMF or electromagnetic frequencies, is they oscillate 60 times per second. That's what comes out of your wall socket. And it's flipping molecules like this 60 times per second. And for some people, that's chaos. What we're supposed to be experiencing is the Schumann frequency, which is the frequency of the Earth, 7.83 or thereabouts. And the cell can handle a range around 7.83, but it cannot handle 60. And so for some people, the EMF alone will cause a deterioration in their health, brain function, and so forth. Apparently if you're sensitive, because of course most people do fine, but if you're sensitive, it may cause a collapse in your cellular function. And so what we believe is happening is when we put kids or people in that chamber, we cancel out the EMF. And so now the cells are at peace and they're happy. And then, because the energy is still there, we know, that's why they call it scalar energy. Energy is never destroyed. We know that the energy is still there. It seems to boost the cellular energy and healing occurs. And what we think happened in the little girl, actually about 2 weeks after she started, she had one long seizure and then everything dropped down. We think what happened is we raised her cellular voltage, her brain cellular voltage enough that it spat out whatever was bothering it, like mercury or vaccine injury or whatever, casein or whatever. And then it dropped back down. So we're kind of optimistic that this may have some important effects on autistic and other issues. We've seen some of the things, if I tell you what we've seen in the scalar chamber, you'll think I'm crazy, but one guy got his sense of hearing back, one guy got his sense of taste back. I don't need glasses anymore, but that's a whole other story. But I think that we're missing the boat when we don't talk about energy medicine, because like we're all saying, the molecules are the same. But think about it. This is what Dr. Noy and I teach fourth-year medical students. And in fourth year, they're supposed to know everything there is, right? They're going to be an MD in a few months. But I tell them, look, they're going to get licensed, right? They'll have people's lives in their hands. And I said, look, you learn the molecular, you learn pharmaceuticals, you learn physiology, anatomy. But what do you know about life? Because you have a live person, 5 minutes later you have a dead person, all the molecules are the same. But if you don't understand the energy, you don't understand life. And so this is where we're starting to do more research and investigation. Because as Dr. Green said, if we don't understand the energy, we're missing a whole major part of what health and healing is about. And we're starting to see that, like this gentleman said about that, what did you call it, magnetic?
Transcranial
Right. Well, the scalar energy system seems to be a not just transcranial, but trans-body. I mean, it affects the whole body system. And there's actually evidence that it affects neurotransmitters. There's a paper published about how it has a similar effect to tricyclic antidepressants. It's like you're wirelessly transmitting the effect of a medicine without having to take the medicine. So anyway, if you want to know more about it, we can talk about that.
So, can I have this around?
Yeah. If you're interested in a follow-up seminar about it, just put your name and email, and then I'll arrange something.
Pass it around.
Yeah.
Other questions? Go ahead.
From me?
Yep.
Okay, I'm sorry I forgot to bring this is a question about fish oil. And I meant to bring bottle, but I can't remember. Most fish oils have like DHA and EPA. Okay, that's right. I meant to bring bottle, so I can't remember. But I've seen like a lot of kind of chatter on the blogs in regards to what that ratio should be. And I was hoping that you could maybe give your commentary on it, because I'm wondering because most of the fish oils that I find have, one is at a certain level and the other one's much higher, and all this chatter on the blog seems to be that it should be the reverse, and what you guys have seen in practice. And I'm sorry for bringing that up, so I don't remember which was more.
Now, often if you have any brands that fulfill the proper numbers that you can share.
Yes,
with us,
thank you for
would be
that.
great.
Yes, that's really where I was going.
Are we allowed to share brand names? Write it down and hold it up. Say it out loud.
No, that's not what we're using.
But at least explain the ratios. I think that's important.
The ratio that you get in standard product is about 360, 240 EPA, DHA. That's kind of how it comes out in a lot of fish products. The Harvard work on bipolar disorder used EPA as a standard, and they used doses up to 3,000 milligrams a day of EPA in adults to demonstrate really significant reduction in bipolar breaks in people with bipolar disease. And for years I used EPA as a prime test of potency. I would shoot for 1,500 to 2,000, which is a lot, in agitated, difficult kids, and about half that much just to feed the brain. In younger kids, DHA is, in my experience, is a lot more important. And I'm taking DHA, primarily DHA myself. There just seems to be more and more support for the high DHA products. And there'll be ratios of around 500 of DHA, 100 of EPA, 120 of EPA. And again, you can go up in multiples up to as much as a couple thousand milligrams, which is a lot. But the elution people, when people are consuming over 10,000 milligrams a day as part of their, and they don't bleed to death. They don't have the bleeding complications surgeons worry about.
Oh, well, I was just, this is my new book. I have a chapter on pathways to inflammation. And one of the thoughts is that inflammation in the brain is a problem for ADHD and similar disorders. And indeed, EPA, DHA are the precursors to microhormones called prostaglandins. Now, if you take too much omega-6, which is found mostly in animal products and a lot of the vegetable oils, you actually set yourself up for more inflammation because the omega-6 puts out a class of prostaglandins that are pro-inflammatory, whereas the omega-3s puts out a balance of prostaglandins that are anti-inflammatory. And the problem in the American diet, at least that's the area that I've been studying for so long, is we're so heavy in omega-6. The omega-6, in this book I have a chapter where I list all the main sources of omega-6 oils. And when you look at the list, you find, well, that's what we're eating. And when you find the source of the omega-3, it's like, well, that's what we're not eating. And what surprises people is chicken and eggs and beef and cold cuts are the worst sources. And what are we eating? We're eating chicken because we're not eating beef. Well, you're not doing yourself that much favor. But in any case, I think that's important to keep the inflammation in the brain down. Actually, a lot of chronic disease is caused by inflammation. And I think that it's important for people to follow a diet that's less pro-inflammatory and more anti-inflammatory.
So if I'm hearing right, higher DHA, is that what I'm understanding?
That's the way I'm thinking.
Yeah, and though, the way I see it, I mean, like, so DHA, I guess I think of that as really helping kind of a little bit more with the neurological system, and EPA, I mean, they're both anti-inflammatory, but I think about EPA as anti-inflammatory, I mean, again, they're both anti-inflammatory, but I think about DHA more specifically for the neurological system, so, I like Nordic Naturals as a company, and, but I like Pro DHA from Nordic Naturals, and so they have a Pro DHA 1000 in a capsule form, which is a big honking capsule. If your kid can swallow a big capsule, they have Pro DHA, which is not the 1000, just the plain Pro DHA. It's a little bit smaller. It can be easier. You can always, just break the capsule and have your kid take that. I do like cod liver oil too. There's vitamin A, vitamin D in there. And then there's a compound that we often use called botanicol. That is it's a pharmaceutical, but it can oftentimes help with speech and language, expressive language. And in order for that to really be most effective, you need to be taking cod liver oil with it. So you don't have to mix them together, but they concurrently, they need to be taking cod liver oil in order for it to really be the most effective. So.
And I'd mention one more thing about botanicol. It's a cholinergic neurotransmitter, which basically is an expression of the parasympathetic nervous system, which is the opposite to the fight or flight part of our nervous system. I call it the receptive, the vegetative, digestive, listening, receiving. And it's the aspect of ourselves that tends to get shut down when we're stressed, afraid, pain, overloaded, sensory stuff, confused, which is where these kids live. Whatever we can do to enhance their parasympathetic state will help them to digest the food better, motor processing, receptive language, and the whole exchange, secretions, digestion. And so there are simple things that we can do, like massage, the Qigong massage, or any kind of massage, touching kids, holding kids, really paying attention to how do we provide safety, how do we really interpret this child's experience of the world wisely and help them to be safer and more comfortable and to be able to relax. There's actually a simple device you can buy, not cheap, but the heart rate variability monitors is by athletic watches that measure the variability of the heart rate, which is directly correlates with parasympathetic output. And so it's a home testing device to see how your kid's doing. Does the heart rate vary with respiration? Speed up, slow down, as it does in a healthy person, or is it pretty locked in? When studies are done on autistic kids, they're pretty locked in. And they don't have, which is sort of a no-brainer. They're obviously stressed. They're obviously, a lot of them have cold, clammy hands, and they're in fight or flight to some extent over time, they're tense. So this, to me, is a really central process of our work, making kids comfortable, and if it means taking them out of school, whatever, to establish them, to help them to find a haven in their body so that they can experience more parasympathetic. They can learn better, they can receive better, and they can heal better. So anyway, botanicol is a drug aiming in that direction. It's a small piece of that.
I could say one thing really quick. He mentioned the Qigong massage, and I really like it because it's a therapy that parents can do at home with your child. So, and it's just nice because you don't have to take your kid to one more therapy, because a lot of times most of you have like all your appointments with everybody that your child is seeing. So the Qigong massage, you can just Google it. But there's a website, and it's qsti.org. So yes, it's qsti.org, and then you can buy on there, or you can get it on Amazon too. There's an instructional book and a DVD. And then oftentimes after parents have gotten the book and the DVD and gone through it, then if you want to come in, then I can kind of go over the massage and do some feedback and make sure you're doing it correctly, give feedback. But I just like it because it's really cost effective, and it helps with, I mean, there's some really interesting research that's been done on it. It was formulated by a medical doctor who was a Chinese medicine scientist, and just some really fascinating research using it with sensory processing disorder, autism, Down syndrome, and you can do it at home for your child. So, yeah. And then Qigong is spelled Qigong. And then massage.
Any more questions?
So I just wanted to say, this is the first time I'm seeing this book, and it's actually just coming out this week. So you guys are, here, and you might like to take a quick peek at it. I mean, because I think inflammation is the cause of so many of our problems. So it makes sense to look at what we're eating in our diets and get a good grip on that.
I have one more question, I guess, for any of you, but if we have any new parents to biomedical, or any parents that have decided they're quit and then want to come back, what are some things that we can do right away? What are some if there are such things as eating steps with our kids, but some things that parents who are new to biomedical, they can start. You just bite off a little piece and grow. Where would you start? Or do you have any suggestions on a good place? Good books, good diets, good things that can, a parent can do as they're just
Let me say one thing first. I put a section on our website with that intention. What can they do if they don't have a doctor? And so that's first thing, just go read a list of things and how to do some things you can do if it's possible.
That's the Evergreen Center, Dr. University's at the Evergreen Center.
Actually, this is that children and autism.
Right now, we just have the website in seconds.
.org. Children and autism.org. Anyway, what a fair amount also about preconceptual and periconceptual care that I really want people to tune into if you're pregnant or thinking about it. If it's wrong, I'll tell you. Go ahead.
Yeah, I mean, I think, that's because, there's some really great information on Dr. Green's website, and he has a fantastic blog that has a lot of information. So, I mean, I think, basics, I think connecting with a Taka mentor is great, because then you can have someone to hold your hand or talk to or ask questions, because I think everything just gets so overwhelming. And I, when we have a new patient visit, then I try to when I have the treatment plan, I try to break things down, I try to explain it, but people still always leave with eyes the size of dinner plates, I'm like, I'm sorry, I know this is a lot, just call me, But, so I think connecting with another parent is really great. And then if you get a Taka mentor, it's a free program, but if you get a Taka mentor, then I think a lot of times you have to initiate contact, with the person, because usually the mentor has several families, more than one person they're mentoring. So don't be afraid to ask questions. And I think, diet, so just trying to get a more nutritious diet is a really great basis. And then eliminating gluten and casein and from the diet first, and then eventually soy. And, I think, some basics that are just good for everybody is probiotics, a good fish oil, and a good multivitamin. Multivitamins, that can kind of vary with what your child has going on, but I think fish oil and probiotics are a good place to start. But usually a lot of our kids require a lot more than just that. And I think just looking at some of the energy therapy, some of the Qigong massage, or things that you can do on your own. For me, I think it's a good way.
to whoever's comfortable, but I've heard at one time, if, you know, you try going away from the wheat and stuff, even if you have a little bit, it's just as bad. Is this the truth? You know, when you say cheating a little bit, with that, is there certain levels, or you really gotta get clean?
I think to do a good test of the diet, you know, it takes 6 to 8 weeks for the gluten and casein peptides, peptides are pieces of protein basically. So it takes 6 to 8 weeks from the time you stop eating it to really get it completely out of your system. So, so in order to get a really good read on the diet, because it's really helping your child, doing at least eliminating, for I'd say at least 2 or 3 months. But then I have families that are, they take out gluten and casein and, I don't see anything, so then they put them back on. But your child might need, other things, looking at food allergies. There are other things, because if they have inflammation in their gut, they're going to have difficulty digesting all kinds of foods. I see some kids that go on the gluten-free, casein-free diet, but then everything is like rice, and all this processed gluten-free, casein-free snacks and stuff, and I totally get it that you need it, when you have times when you don't have time to cook, you're running out the door, but it really shouldn't be the mainstay of the diet, shifting from processed food to processed gluten-free, casein-free food.
Yeah.
So, yeah.
And do you recommend doing blood testing, panels? Like, is that the best practice? Or not always necessary?
For gluten and casein,
Well,
there's different tests, but nothing is 100%. And I've still seen kids, I've seen so many families that have come to me, my pediatrician tested for gluten and casein allergies, and it's not there, so then they don't need it. That's going to test to see if their body is making an antibody that reacts to gluten and casein, and it's only testing one type of antibody. Kids can have issues with it because they don't have enough, or they're not making enough of the enzyme DPP4 to break it down, and that's not going to show up on the test. And at least the food allergy test. And I've seen kids that have still tested negative on all of the tests and still respond to the diet. So I just tell parents, and most of those tests aren't covered by insurance. So I just tell parents, save your money and just do a trial on the diet. Really. So.
Yeah, I add Carl Reichelt is one of the original researchers. He's a Norwegian fellow studying this. Does urine peptides testing in kids, looking at a whole array of peptides that are neuroactive, psychoactive. They're coming out in kids' urine, as in schizophrenics' urine. And he can identify the gluten and casein morphine peptides in kids. And many of the kids that are on the diet, carefully on the diet, are still excreting those peptides months later. One of his concerns is corn. He has gluten, not gluten that's got toxic like in celiacs, but some kids react to corn and excrete weird peptides, and soy. I'm really a devotee of the diet. Tom Malter, one of my colleagues who wrote a wonderful cookbook, who himself is a celiac, surveyed 80 companies that sell gluten-free products, labeled gluten-free, and set up his criteria for satisfying true gluten-free properties. That is, they test regularly, they have standards, and they don't cross-contaminate. And he only found something 10 or 15% of them actually met those criteria. He would say about 90% of foods that are advertised gluten-free are not, because they're processed. Other thing is that in celiacs, people with celiac disease have gluten enteropathy and gut damage. If they follow a gluten-free diet with a once a month, only about 60 or 65% of them show healing if you do re-biopsy. If they, this is one study, if they report, I never eat it, I never, to my knowledge, have gluten, about 95% of them show healing, which means even 5% of those fail to heal. And there's some other gluten sensitive conditions that likewise strict diet is not always completely successful because the damage is slow to heal and maybe propagate other food-related issues. So I'm not really devoted to it. When we look at depression and anxiety, and people with celiac disease are markedly increased because those amino acids that are necessary to make dopamine and serotonin, melatonin, epinephrine, those neurotransmitters we like, they come through the gut. They come from protein digestion, the big molecules, assimilation, what I was saying about folinic acid and absorption before. If your gut isn't behaving, there are lots of things that aren't going to get in, even if you're eating well. So healing the gut is just such a central piece.
I have to say, as a parent, I took the gluten and case-free diet. I didn't see any reactions about 2 months later, but that was because I needed to go farther. My son needed no grains and no starches. And within a month of doing that, my son gained expressive language and also receptive language. So where he had done either before. So I think it's two things. You know, you may not see a reaction. The reason you may not see a reaction is because I didn't take it far enough. I had to go to a more extreme. And all our kids are individual, but diet has been, as a parent, the hardest part, but it's also been the biggest part to stick to, at least in my experience. I saw another hand.
For one thing, it cancels out EMF. If you have time, I'll show you. I have a handheld Gauss meter, and I'll show you that EMFs are canceled out in the room. But the theory is that when you sit in the room, every cell is like a battery. Your eyes, your blood, your skin. And the theory is that not only does it cancel out the negative EMF, but it's basically adding energy to your body as you sit there, because there's energy in the room. And as a result, for brain function, there's actually evidence of increased brain voltage. If you increase brain voltage, a couple of things happen. Number one, you may recruit cells that you need to tell you to go to the bathroom, or respond to a parent, or to just be more aware of your surroundings. The other thing is when your cellular energy is raised, you start spitting out toxins. You start dumping the junk that might have been affecting you, including, adverse peptides and proteins and toxins. So the scalar energy has nothing to do with oxygen. It's purely energy medicine. And, it's hard to explain in a short time. That's why I'm offering to do a special seminar to explain what that is. But if you have time, we can pass through that. The scalar room is operating now. It operates 24 hours a day because it sets up a resonant field. And probably 2/3 of the people can feel a little tingling sensation in the room, but that's about it. But this is direct. It cancels out EMF, and there's some direct energy component as well.
Thank you. And that if anyone would hear that after we're done, you're welcome to get a tour. Go ahead.
A quick question, Dr. Shintani, you must be talking about a Faraday cage, eh?
No,
Energy.
no. Faraday cage will block out things coming from the outside. This is blocking it out from the inside. Yeah.
Magic.
Yeah.
I wanted to say too, the diet that Christy was talking about, that's the GAPS diet. So, I mean, there's, you can just Google GAPS diet, and it doesn't mean it's the right diet for every kid. It's really hard, but I've definitely seen, I know that, Dr. Green and I both seen some really amazing things with some kids that really need it, and it's a diet that's, especially if your kid has a lot of inflammation, a lot of gut inflammation, we've seen some pretty amazing things with that diet, so.
Let me just say one thing about gluten. Last year, I put this picture in here of a graph of a study done that's showing that gluten might not be the problem. It might be something else in the wheat. So that's why I agree with you. The testing may be useless because gluten may cause problems outside of allergy. And it may not be the gluten, because in this test they had people who claimed to have gluten sensitivity, and they had a placebo, high dose and low dose, pure gluten now, and there was no difference. At least in the sense of, these are mostly GI symptoms. They felt lousy when they took gluten. However, they said there is such a thing as wheat sensitivity. So they're thinking it could be the short chain carbohydrates. Some of the elements are poorly digested, or it could be other things associated with it. It could be, and nowadays we have so much genetically modified stuff, who knows what the heck is coming in along with our food. And there's a study that shows that there's correlation between ADHD, autism, and the use of GMO food and GMO pesticides. And, you know, so I'm saying, don't get stuck, don't get hung up on one substance. You should, as these doctors are saying, you should look at the whole diet and test it out on your specific kid, because your kid may respond differently. One of the theories they say here is the gut flora may be what's changed.
Yes, please.
I wanted to ask a question to Dr. Lee about bipolar. This is about my friend's teenager. Actually, whole family is in restriction. Father, mother, and everybody's taking medication for ADHD and depression and bipolar. But bipolar is something not familiar to me because my kids are ASD. But if a bipolar is that in the station of the ASD, or is it totally different? But my question, the second one is that how we can start to treat bipolar.
The question is bipolar and ASD, are they extensions of one another? Do they live in the same family? Is there any connection? And if so, how would you begin to treat bipolar, or is it a completely separate?
I think of it as a really separate disorder. One of the similarities with autism is it's diagnosed clinically, without MRI, EEG, blood test, anything. So it's diagnosed based on the patient's output, what you see. There is an increased tendency to diagnose bipolar disorder in kids that have been on the spectrum or have some spectrum issues. I don't think it's because the diseases are necessarily causally related. We really don't know what causes bipolar disorder. There's a lot of genetic concurrence, but that also means that a person with bipolar disorder is growing up in a bipolar home with a lot of difficult, stressful, interpersonal kinds of experiences. But I have seen a number of kids who have a dual diagnosis, or at least have an autism diagnosis, maybe on the spectrum, and who later are diagnosed bipolar. And I question that. A lot of these kids are on multiple medications, and some SSRIs and neuroleptics and big drugs, often 3 or 4 drugs when they come in, and they have 3 diagnoses. And one of the diagnoses is that drug and its side effects, and another one is this combination of things. So it's really hard to hard to see. I don't diagnose and treat people with bipolar disorder, but if I were to start working with somebody, it's exactly the same kind of considerations. How do we improve the milieu, their lifestyle, their diet and nutrition, their biochemistry, and the same kinds of thinking about inflammation applies to people with that diagnosis.
And there's, I guess, one thing to add, I mean, there's a whole field of integrative psychiatry, and it's basically the exact same approach, you know, pretty much the same approach that we're taking, and because it's all about looking at, you know, like Dr. Shintani talked about, nutrition as the basis, and getting the nutrients that you need to feed your brain, and then the connection between the gut and the brain. And, you know, looking at, you know, biochemistry, like Dr. Green said, and you know, a lot of these you know, neurological diseases, a lot of them, like Dr. Shintani said, are related to inflammation. And, you know, there's a really interesting research paper that Dr. Green just passed on to me about using this approach in Alzheimer's and finding that it's helping them. You know, so I mean, basically, if you get your gut healthy, your brain healthy, you decrease inflammation, and you're looking specifically at all these biochemical issues, and you get that better, then the person is going to be healthier, you know, no matter what condition they have. But especially with any kind of neurological condition, we see a lot of overlap in this whole field of integrative psychiatry that basically just uses the same approach.
We have 8 minutes. All the work we need to have to get out of these people. So, 8 minutes. Any more questions? Yes.
It would be so much easier to somehow let me know where to get the fish oil, olive oil, without doing a lot of research.
Absolutely, it's all right, yes.
I just had a little comment about the bipolar. Like, I work with a lot of kids on the spectrum, and I find so many have the dual diagnosis, and from an OT perspective, like, this is sensory integration where just overload and you know, recovery, you know. So I think too in Hawaii, I'm making a big overstatement, but that, you know, all this the parents, it goes back to your thing about the intention. You know, some parents have like this, there's a big problem here, and I need another diagnosis, or, you know, versus doing this, you know, kind of treating, you know, kind of one step at a time, which is just saying, oh, like this is part of the autism, the sensory, you know, versus, oh, okay, another diagnosis, another diagnosis. So over-diagnosing and taking the validity into the medical system.
Thank you. Yeah, no, it's good. They're all related. We're calling time.